With us now is Dr. Laura. How are you?
Good. How are you?
Good. So tell us about your experience and what all these letters after your name stand for.
So I'm Dr. Lauren Macaluso. I actually have a breastfeeding medicine practice. So I'm a pediatrician with a special interest in breastfeeding, and my whole practice is built around breastfeeding moms and babies.
Excellent.
And that's all I do every day.
And so you're a fellow with organizations?
I am. I'm a fellow of the American Academy of Pediatrics, fortunate enough to be the co-breastfeeding coordinator. And I'm also a fellow of the Academy of Breastfeeding Medicine, which is a worldwide physician group advocates for breastfeeding for moms and babies. And I'm also part of Allied Physicians Group. I know I got a lot of titles going on right now, but and I'm a member of the Allied Support Breastfeeding Team, and we're trying to meet and reach goals for breastfeeding and our mothers across the Allied group practice.
One of the difficulties, I think, after you have a baby is to decide whether it's breast or bottle. So do you encourage them to be breastfed, but you also help people that need to be bottle-fed babies?
We do. Okay. You know, all pediatricians, we should all be encouraging breastfeeding. You know, it's actually, in this day and age, not a lifestyle choice, but actually a public health issue. There are so many known now benefits, but also looking at as risk reduction to moms and babies in terms of ovarian cancer and breast cancer in moms. And in babies, you name an infectious disease and it's reduced, be it ear infections, vomiting and diarrhea syndromes, respiratory illnesses, and then other things as well later on in life. So really, to know those benefits and those risk reduction is huge, and to help make it happen. So I do prenatal visits as well. If a mom is on the fence or not feeling that confident in what's to come, you can really educate and empower that mom and help her to be more, reach her goal.
Now, do you also help them learn how to latch on? Do you actually go through the whole process about how to get your milk to flow and things like that?
Yeah, excellent question. I do. Okay. My practice is unique in that I see mom and baby together. I spend about an hour and 20 minutes with each dyad, and I take a full history, starting from their pregnancy history to their delivery to their postnatal, focusing a lot on how feedings are going, how, pretty much, are you doing any supplementation or do you have to? We hope that there's a medical indication if you do that. Weigh babies in the office, and we can actually test feeds where we check mom and baby, weigh baby before a feed, really truly hands-on assist her with a feed in the office, weigh the baby after, and do have some objective data into how things are going.
Oh, that's fantastic. I do remember when I was breastfeeding my children too, like broccoli, certain things you want to avoid, certain things you want to eat, maybe not the tomato sauce, because it all is a whole process. So it's great that you're educating them about that.
Yeah, we have a little more in a good way. I think there's just more and more in a good way. Research, information, those of us as physicians looking at this, so really global recommendations are eating everything in moderation.
Oh.
So you can have that nice serving size of broccoli. You can have that serving size of chili. The only thing to still be careful of, like pregnancy, is those potentially high mercury fish. That's really the only thing that you want to make sure that you're on top of. Otherwise, yeah, spicy is fine. I find a lot of my patients leave the office and they go out and get something that they didn't know that they couldn't have.
They're like, wow, doctor said I could. Exactly, who knew? So, and I think that's why expos like this are so important, because it's experts like yourself that are having seminars here and you're bringing awareness to the community. Are you having a good time?
Having a great time. I am being not only, expectant parents, dads are getting involved at this, which I think is fabulous, but I'm also meeting other vendors from all, different forms of life helping mothers, which is always great.
Excellent. Thank you so much for being here. And so Allied Breast Support Group, yes?
Yeah,
okay,
so I know we're kind of a whole support team, but not under one roof. So it's myself seeing patients privately in New Hyde Park in my office. There's Dr. Jen Scher, who's at the other end of the island in Riverhead, who has part of her general peds practice is breastfeeding medicine as well. And then we have lactation consultants that are doing home visits and office visits throughout other allied practices throughout Long Island.
What a gift. You're a real gift to the community. Thank you for being here.
My pleasure. Thank you.
Yay.